Did you know that a vitamin sitting in your medicine cabinet right now could be silently increasing your stroke risk by up to 40%? Before you dismiss this as just another health scare, consider this shocking reality. Millions of seniors are unknowingly taking a supplement that researchers now believe may be doing more harm than good. The vitamin I'm talking about isn't some obscure compound you've never heard of. It's one of the most commonly recommended supplements for people over 50, and chances are you or someone you love is taking it right now. I'm about to reveal information that could literally save your life or the life of someone you care about. What you're going to learn in the next few minutes will challenge everything you thought you knew about vitamin supplementation and stroke prevention. This isn't about fear-mongering or pushing an agenda. This is about hard science that's been hiding in plain sight, and it's time you knew the truth. My name is Dr. Sarah Chen, and I've spent the last 15 years researching cardiovascular health and nutrition. What I discovered while reviewing recent clinical trials kept me awake at night because I realized how many people might be unknowingly putting themselves at risk. The vitamin I'm referring to has been marketed as a heart-healthy supplement for decades, and the revelation that it might actually increase stroke risk has sent shockwaves through the medical community. Here's what makes this discovery so disturbing. For years, we've been telling seniors to take this particular vitamin to protect their hearts and bones. Medical professionals, including myself, have recommended it based on what we thought was solid science, but new research has uncovered a dark side that pharmaceutical companies and supplement manufacturers don't want you to know about. The vitamin in question is calcium. Yes, calcium, the same mineral your doctor probably told you to take to prevent osteoporosis and maintain bone health. But here's the terrifying truth that's emerging from recent studies. Taking calcium supplements, especially in high doses, may significantly increase your risk of stroke and heart attack. Let me break down exactly what's happening inside your body when you take these supplements. When you consume calcium through food, your body absorbs it slowly and steadily throughout the day. Your digestive system is designed to handle this gradual intake, and the calcium gets distributed to your bones and tissues in a controlled manner. But when you take a calcium supplement, especially those mega doses of 500 to 1,000 milligrams, you're flooding your bloodstream with far more calcium than your body can properly process at once. This calcium overload creates a cascade of problems that researchers are just beginning to understand. First, when calcium levels spike suddenly in your blood, your body goes into panic mode. It starts depositing this excess calcium wherever it can, and unfortunately that includes the walls of your arteries. This process, called arterial calcification, makes your blood vessels stiff and narrow, dramatically increasing your blood pressure and stroke risk. But the nightmare doesn't stop there. High calcium levels in your blood also interfere with magnesium absorption, creating a dangerous mineral imbalance. Magnesium is crucial for proper heart rhythm and blood vessel function. When calcium displaces magnesium, your heart starts beating irregularly, your blood pressure spikes, and your risk of both stroke and heart attack skyrockets. The most chilling part of this discovery is how quickly these effects can occur. Unlike other cardiovascular risk factors that develop over years or decades, calcium-induced arterial changes can begin within hours of taking a high-dose supplement. Some studies have documented measurable increases in arterial stiffness within just 24 hours of calcium supplementation. Dr. Ian Reid from the University of Auckland conducted one of the most comprehensive studies on this topic, following over 11,000 participants for several years. His research team discovered that people taking calcium supplements had a 36% higher risk of heart attack compared to those who got their calcium from food sources. Even more alarming, the stroke risk increased by approximately 20% in supplement users. What makes this research so credible is that it wasn't funded by any organization with a financial interest in the results. Dr. Reid and his team were actually trying to prove that calcium supplements were beneficial. They were shocked by their own findings and initially thought they had made an error in their data analysis. But after reviewing their methodology multiple times and comparing their results with other independent studies, the conclusion was undeniable. The supplement industry's response to this research has been predictably defensive. They've funded counter-studies and hired public relations firms to downplay the risks. But when you look at the independent research from universities and government health agencies around the world, the pattern is consistent and terrifying. Country after country is finding the same results. Calcium supplements increase cardiovascular risk in seniors. Here's what's particularly insidious about this situation. The people most likely to be taking calcium supplements are postmenopausal women and elderly men, precisely the demographic already at highest risk for stroke and heart disease. We're essentially giving a loaded gun to people who are already standing on the edge of a cliff. The recommended daily intake of calcium for adults over 50 is 1,000 to 1,200 milligrams. Most people can easily meet this requirement through dairy products, leafy greens, sardines, and fortified foods. A single cup of yogurt contains about 300 milligrams of calcium. 2 cups of milk provide 600 milligrams. Add some cheese, broccoli, or almonds to your diet, and you've hit your daily target without any supplements. But supplement manufacturers have convinced millions of people that they need to take additional calcium, often in doses that far exceed what their bodies can safely handle. Some popular calcium supplements contain up to 1,500 milligrams per tablet, which is more than the entire recommended daily intake in a single dose. The tragedy is that this calcium supplement craze has been driven more by marketing than by science. Companies spend billions of dollars advertising the benefits of calcium while conveniently ignoring the mounting evidence of risks. They've created a culture of fear around osteoporosis and bone fractures, making people believe that more calcium automatically means stronger bones. But here's another shocking revelation. Taking calcium supplements doesn't even effectively prevent fractures in most people. Multiple large-scale studies have shown that calcium supplementation has minimal impact on fracture risk, especially when vitamin D levels are adequate and people engage in regular weight-bearing exercise. The real keys to bone health are much more complex than just calcium intake. Your bones need vitamin D to absorb calcium effectively. They need magnesium, vitamin K, and other trace minerals to build strong bone matrix. They need physical stress from exercise to stimulate bone formation, and they need adequate protein to provide the building blocks for bone tissue. Taking a massive calcium supplement while ignoring these other factors is like trying to build a house with nothing but bricks and no mortar, foundation, or blueprint. It's not just ineffective, it's potentially dangerous. So what should you do if you're currently taking calcium supplements? First, don't panic and don't stop abruptly without consulting your healthcare provider. But do start having a serious conversation about whether you really need them. Ask your doctor to evaluate your actual calcium intake from food sources. Most people are surprised to discover they're already getting adequate calcium from their diet. If you're genuinely at risk for calcium deficiency, which is relatively rare in developed countries, there are safer alternatives. Consider taking smaller doses spread throughout the day rather than one large dose. Look for calcium supplements that also contain magnesium and vitamin D to help with absorption and balance. Better yet, focus on increasing calcium-rich foods in your diet rather than relying on supplements. The bottom line is this: the supplement industry has created a false crisis around calcium deficiency while ignoring the very real risks of calcium excess. They've convinced millions of people to take supplements that may be shortening their lives rather than extending them. This isn't just about calcium either. It's a wake-up call about the entire supplement industry and how we approach nutrition and health. We've been conditioned to believe that if a little of something is good, more must be better. But when it comes to nutrients, this thinking can be deadly. Your body is an incredibly sophisticated system that has evolved over millions of years to extract nutrients from food in precise amounts and combinations. When we try to outsmart this system with isolated compounds in megadoses, we often create more problems than we solve. The evidence against calcium supplements is now so overwhelming that several countries have issued official warnings about their use. The medical community is finally starting to acknowledge what independent researchers have been saying for years. These supplements may be causing more harm than good. If you take away just one thing from this information, let it be this: your health is too important to leave to marketing campaigns and profit-driven recommendations. Do your own research, ask tough questions of your healthcare providers, and remember that the safest and most effective way to get nutrients is usually through a balanced whole food diet. The vitamin that was supposed to protect your heart and bones may actually be putting you at risk for the very conditions it was meant to prevent. It's time to stop believing the hype and start protecting yourself with knowledge and informed decisions about your health.